Hi, it's Dr. Lloyd again, here to answer a question on when Victoria's COVID-19 second wave will have finished or have been conquered. I should say at the outset that I'm not an epidemiologist, but I'm a mathematician and a data scientist doing mathematical modeling to derive insights. So to answer this question, I first looked at when the daily new COVID-19 cases would be under 10, and following that, when the active COVID-19 cases would be small enough so that we can say that we conquered the second wave, hopefully preventing a third wave and further spread. So I found that it would take us 23 days to get to under 10 daily new COVID-19 cases, which takes us until the 20th of September 2020. I fitted the logistic regression to Victoria's cumulative COVID-19 infections. So the blue dots that you see here are the observed cumulative COVID-19 infections for Victoria from the 26th of May. And the orange curve here is the fitted logistic curve that follows the observed values very closely. In fact, I got an R squared of 0.999, which suggests a very good fit. And by the 20th of September, we expect that we are going to have around 19,600 COVID-19 infections in Victoria. On to my second question. When will the active COVID-19 cases be small enough so that the second wave would have been conquered, preventing a third wave? The answer to that is more than 23 days. It depends on how well we smash R0. I found that if R0 is around 0.1 from this point on, we should get to under 100 active cases by the 18th of October. Now, if R0 is smaller than that, around 0.01 from this point on, we could get to under 100 cases by the 13th of October. And if it's slightly greater, like 0.15, I found that we should get there a couple of days after 18th of October, that is the 21st of October. Now, before we get further into this discussion, I need to lay the groundwork for the modeling done. Compartmental modeling simplifies mathematical modeling for infectious diseases. So I chose an SIR compartmental model where I have a compartment for susceptibles, which has a hole in it. You can kind of think of it like a bucket that leaks into a bucket or compartment underneath the infectives, which again has a hole in it which leaks into the recovered compartment. Now to a comment to purely the technical audience, and also a spot where I get to lay out the assumptions and the initial values to this compartmental model. The change to the susceptible compartment with respect to time is given by this first ordinary differential equation, and the change to the infective compartment with respect to time is given by the second ordinary differential equation, and the change to the recovered compartment with respect to time is given by this third ordinary differential equation. And the three of them together are a system of coupled nonlinear ordinary differential equations where no closed form analytical solution exists. So I use the fourth order Runge-Kutta method to solve this numerically. A couple other parameters that I should introduce you to. N here is nothing but the sum of the susceptible compartment plus the infective compartment plus the recovered compartment. And in our case is the size of the Victorian population, N, okay? Beta here is the rate of transmission of the infection, and gamma is the rate of recovery of an infected person per day. And you may have seen something called the R0, or the reproductive number, in the news mentioned. And you've heard people say that if R0 is greater than 1, the infection is going to spread, and if R0 is less than 1, the number of infections, daily new infections, should be going down. So R0 is defined to be equal to beta divided by gamma, which now leads me to one of my assumptions. So I assumed that it takes 14 days to recover from COVID-19. So that means then gamma must be defined to be equal to 1 on 14. And now to my initial values. So N is the size of the Victorian population, and as of ABS most recently, that is 6,650,100. And as of the 26th of May, the number of active COVID-19 cases that we had in Victoria was 56. and the size of the recovered compartment on the 26th of May was 1,554. So if you do some math, you'll see that the susceptible compartment on the 26th of May was 6,649,490. A very important comment about R naught. We had two controlling parameters, beta and gamma. Beta is given in terms of gamma because beta is equal to R naught times gamma. And we assumed gamma to be equal to 1 divided by 14. So using trial and error, I was able to tweak R naught to get values for beta put into this compartmental model. And I was able to model the infective compartment and fit it to the active COVID-19 infections in Victoria, in particular the second wave that I'm interested in. So that meant that the R naught was 1 between the 26th of May and the 16th of June. Why did I choose to start from the 26th of May? Well, that was when schools reopened and our children went back to school. And so following that, on the 1st of June, we saw restrictions easing where we were allowed gatherings of up to 20. And soon we saw the impact of that, where we saw the R naught then spike, creating our second wave, and found that R naught to be 2.75 then between the 17th of June and the 17th of July. Now in that period, we did have tightening of restrictions, which came on the 20th of June, I believe, which was then gatherings reduced to 5. And then we saw on the 22nd of July, a month later, we had a mask mandate. And so I think the impact of retightening of the restrictions brought the R naught down to 1.76, but still above 1, which meant that the infections were growing. Okay, and so then as a result of the mask mandate on the 22nd of July, we started to see that impact there, and it really showed up here on between the 5th of August, where we had the R naught at just about 1.07. In fact, on the 2nd of August, we went into stage 4 restrictions and a curfew. And as a result of that, we are really starting to see those benefits in R naught, where I believe that between the 16th and 19th of August, it came down to 0.55. And currently, I believe it's around 0.43. Now, on the 20th of August, we had a whole lot of active cases reclassified to inactive and recovered. We had over 2,000 cases, 2,291. And that's just because of the way the system works. And it points to our data, the underlying data that I'm working with is the active cases not being clean. And that's one of the challenges that we just have to cope with in this model. Now, using trial and error, I was able to tweak R naught to get values of beta to model the infective compartment so that we could fit it to the active COVID-19 cases in Victoria's second wave. And what we see here in this graph is the red infective compartment, which closely follows and mirrors the observed COVID-19 active infections in Victoria. One of the irregularities in the observed data was you see a huge drop from there to here, which was when Victoria reclassified over 2,200 coronavirus active cases to inactive and recovered. And the other comment I want to make is that following that, from this point forward, I've set R naught to be 0.1. And I believe that's fairly reasonable, because even when Wuhan was locked down, they managed to get their R naught to 0.13. With that being the case, if that is the case, we should expect that when we get to the 18th of October, that the number of coronavirus cases in Victoria should be under 100. I should point out that I did try and use the R naughts published by Daniel Andrews recently for Victoria, and I found it to be not compatible with the underlying data that I was working with, that is the observed active cases, COVID-19 cases in Victoria. And I believe that there are reasons for it, and I think one of it could be procedural, perhaps the time involved and the human effort involved in moving a case from active to inactive, and then updating it and making that public to people and so on. I do believe that that perhaps contributed to it, but let me show you the result of it. So this is the output of the infected compartment using the R naughts provided by Daniel Andrews. While the shape of the curve does look like what the observed values look like, the magnitude is actually about 30 times smaller. And if I include the observed values, you'll see that happen quite obviously. The blue dots here are the observed values, which is, gets all the way up to about 8,000 active cases, whereas the red curve is all the way down here at the bottom. And this was one of the reasons why I had to tweak the R naughts using trial and error to work out what they were. I do want to make this point that it takes a lot longer to bring down the active COVID-19 infections compared to the daily new COVID-19 infections. 30 days like we saw in the modeling here. And perhaps that's something we should be aware of next time around when we ease restrictions. And to further complicate matters, Victoria did have hotel quarantine issues, which also helped spark our second wave. And all of this signifies the gravity of the challenge of this pandemic that's in front of us.
Hey, you've made it this far. Thank you very much. Now don't forget to like, subscribe, share, and click on that bell icon. I'll appreciate that. My contact details are below, so please reach out. Thank you.